Hello, and welcome back to my channel. Today's somatic routine is on an issue that many of us face: headaches. Let's begin. Gently place the palms of your hands over your eyes, allowing complete darkness to settle in. By blocking visual input, this exercise reduces stimulation to the visual cortex and helps interrupt the continuous stream of sensory information that can keep the nervous system in a state of alert. This decrease in cortical activity can relieve tension patterns in the head and neck that are often maintained by visual overexertion or screen fatigue. With less sensory load, the brain has an opportunity to regulate and shift out of a stress-driven state, which is a crucial step in relieving and preventing headache symptoms. And now, allow yourself to integrate for about 20 seconds. Now let your head gently fall back. Softly stroke the sides of your neck to prepare the tissue. Then tilt your head to the left, hold down the platysma with your hands, and begin a slow nodding motion in the tilted position. This movement creates a dynamic stretch through the superficial and deep necklines, releasing chronic tension in the sternocleidomastoid and suboccipital muscles, key contributors to cervicogenic headaches. By anchoring the platysma, you provide gentle fascial resistance, which enhances proprioceptive feedback and helps reset dysfunctional muscle firing patterns around the head and neck. The nodding motion activates deep neck flexors while decompressing areas of neural congestion, reducing referred pain often felt as tension behind the eyes or at the base of the skull. This exercise not only relieves physical strain, but also supports a calmer, more regulated state in the brainstem where pain modulation begins. And now, switch sides. And now, allow yourself to integrate for about 20 seconds. The next exercise is a SelfNeck Massage. Using both hands, gently sweep forward along the sides of your neck in a slow, deliberate motion. This technique helps release chronic tension in the key neck muscles like the sternocleidomastoid, scalenes, and upper trapezius, muscles that often become tight from poor posture, stress, or prolonged screen use. When these muscles are tense, they can compress blood vessels and irritate surrounding nerves, contributing to headache symptoms. The forward stroking motion not only softens the myofascial layers but also sends calming input to the brain via mechanoreceptors in the skin and fascia, helping to shift the nervous system out of a fight or flight state. By relieving this muscular tension, we reduce pressure and restore normal movement in the cervical spine. And now, allow yourself to integrate for about 25 seconds. The next exercise is shoulder shrugs. Lift your shoulders up toward your ears with an inhale, then exhale and let them drop completely. This movement activates and then releases the upper trapezius and levator scapulae, muscles that are almost always involved in tension-type headaches due to their role in guarding and stress holding. By rhythmically contracting and relaxing these muscles, we interrupt habitual bracing patterns and increase blood flow to areas that often become ischemic under chronic tension. The sudden drop of the shoulders provides a proprioceptive reset to the brain, signaling that it's safe to release. This not only reduces the mechanical pull on the base of the skull, but also helps downregulate sympathetic arousal, creating the internal conditions necessary for headache relief. And now, allow yourself to integrate for about 30 seconds. The next exercise is a Massitor muscle release. Using both hands, apply gentle motions along your cheeks just above the jawline. This could be a vibrating, gliding, or circling motion. Do not be afraid to use your knuckles for some pressure. The masseter is one of the strongest muscles in the human body relative to its size, and it's often chronically tight from clenching, grinding, or emotional stress, all of which can contribute to tension headaches and jaw-related pain. By stimulating this area with rhythmic touch, we reduce excessive tone in the jaw muscles and ease pressure on the TMJ, which shares neural pathways with the trigeminal nerve, a major player in headache generation. This release helps interrupt the stress feedback loop between the jaw, head, and nervous system, promoting a more balanced, pain-free state. This is most likely one of the most underrated techniques. And now, allow yourself to integrate for about 20 seconds. The next exercise is alternating nostril breathing. Gently close your right nostril with your thumb, inhale through the left, then switch, closing the left nostril with your index finger, and exhale through the right, continuing in a slow rhythmic cycle. Inhale, switch, exhale, inhale, switch, exhale. This breathing technique balances activity between the left and right hemispheres of the brain and directly influences autonomic nervous system regulation. By modulating input to the olfactory and trigeminal nerves, both closely tied to brainstem activity, it helps reduce cortical excitability and dampen the overactivation that often underlies tension in migraine headaches. Slow, controlled nasal breathing increases carbon dioxide tolerance and improves cerebrovascular tone, enhancing blood flow to the brain while reducing inflammatory signaling. And now, allow yourself to integrate for about 15 seconds. The last exercise is a scalp massage. Use your fingertips to gently move the skin of your scalp, including light, sustained hair pulling to create a lifting sensation. This technique stimulates the dense network of sensory nerves in the scalp, including branches of the trigeminal and occipital nerves, which are commonly involved in tension and migraine headaches. The combination of massage and gentle traction increases blood flow, reduces fascial restriction, and activates mechanoreceptors that calm overactive pain pathways in the brainstem. Hair pulling engages the connective tissue layers of the scalp and cranium, helping to release superficial tension patterns that often go unnoticed but contribute to head pressure and fatigue. This final step provides a deeply grounding effect, easing neural overactivity and leaving the system in a more relaxed, regulated state. And now, allow yourself to fully relax. Headaches are no joke. They can mess with your focus, your mood, and your day. But the upside is that so many headaches are linked to muscle tension, stress, and nervous system overload, which means that there's actually something you can do about them. These exercises might seem simple, but they're targeting real patterns that build over time. Releasing the neck, calming the jaw, dialing down the sensory input. This is how we take pressure off the system instead of just pushing through it. Come back to this routine whenever you feel one coming down, or even better, before it gets there. The more regularly you practice, the more your body learns to let go before the tension turns into pain. You're building resilience with every session.